Hello, I'm Hope Rugo, a professor of medicine and director of breast oncology and clinical trials education at the University of California, San Francisco's Comprehensive Cancer Center. It's really a pleasure to welcome you to this video today, an introductory video to tell you more about cold caps at UCSF. We started investigating cold caps to prevent hair loss from chemotherapy for early stage breast cancer more than a decade ago. We've now, of course, seen efficacy or effectiveness of using scalp cooling for patients who are receiving a wide variety of chemotherapy agents for both early and late stage breast cancer, as well as for other malignancies where chemotherapy is given that causes hair loss. We have worked with a number of different types of cold caps and are hopeful that the information that we provide you today will cross the different options that you may be provided with. We also have been fortunate to work with a philanthropic organization called Hair to Stay that provides information and funding for patients who cannot afford cold caps on their own. And we're thrilled to have been involved with the funding for cold caps with the new coding from Medicare, which should provide for most insurance companies some funding to offset the costs of cold caps. As you know, the FDA has cleared cold caps for prevention of chemotherapy-induced hair loss, not just for breast cancer, but for other malignancies as well, excluding patients who have cancers of the blood. This video will give you information about your options for cold caps at UCSF. You will learn about how cold caps work, scalp cooling side effects, and the logistics of cold caps on your infusion days, and more. Thank you for joining us.
Hello. Thank you again for joining us today to learn more about cold caps and scalp cooling, a technique to reduce your risk of hair loss from chemotherapy. As Dr. Rugo mentioned, in this video, you will learn how cold caps work, how they reduce your risk of hair loss from chemo, your options for cold caps at UCSF, and what next steps you will need to take to use cold caps during your chemotherapy infusions. So, what are cold caps? A cold cap is a medical device that you can use during each chemotherapy treatment to increase your chance of keeping your hair. By cooling your scalp, this device shrinks or narrows the blood vessels in your scalp, reducing blood flow and the amount of chemotherapy drug that is delivered to hair follicles that support hair growth. The coldness also decreases metabolic activity of the hair follicles. Overall, if the hair follicles are less active, they may be less sensitive to the chemotherapy. This means that chemotherapy may have less of a chance of damaging these hair follicles. How are cold caps used? A cold cap is worn before, during, and after your chemotherapy treatment. During the pre cooling time, or the time before your infusion begins, the cap cools your scalp down to prepare for the chemotherapy infusion. Because the level of chemotherapy drug peaks in your system immediately after completion of your infusion, continued constriction of blood flow to your scalp for a few hours after treatment is the best way to protect your hair follicles. This post cooling time is determined by the type of chemotherapy you are receiving. The post cooling time can include the time during which you might be receiving drugs that do not cause hair loss, such as antibodies. Depending on the type of chemotherapy you receive, without cold caps use, you may have complete hair loss. Hair loss begins 3 to 4 weeks after your first infusion. Cold caps reduce hair loss from chemotherapy for most patients, depending on the type, schedule, and dose of chemotherapy. However, even with cold caps use, some hair loss will occur, and this may occur in patches. All patients experience more thinning or shedding than normal, and there is no guarantee that you will keep most of your hair. Common side effects from cold caps include feeling cold. Other common side effects include mild to moderate headaches and scalp pain. like a brain freeze. Low doses of pain medication help with these symptoms. Check with your healthcare provider in advance to see what kind of pain medication would be appropriate and if a prescription would be needed. If the scalp or skin where there is no hair is not protected from direct contact with very cold temperatures, the skin can be damaged from the cold. This rare side effect can result in blistering and darkening of the skin that gradually resolves over time. Protecting the scalp and the skin without hair prevents this side effect. Depending on the device you use, headbands or other hair protection will be provided. Moleskin can also be useful in protecting the skin and can be purchased over the counter at most drugstores. So, why use cold caps? There are many reasons why patients consider cold caps. First, if patients do lose hair during treatment, scalp cooling can help with hair regrowth once chemotherapy treatment is completed. Second, some patients hope to preserve hair to maintain privacy about their diagnosis around coworkers or other acquaintances. Others believe that using cold caps can help in managing a cancer diagnosis with young children. And still, other patients report that maintaining an element of control and their identity is central to their mental wellness throughout treatment. There are some patients who cannot use a cold cap. If you are a patient with cold sensitivity, certain cancers, or you have any of the conditions or diagnoses listed here, you are not advised to use cold caps without your oncologist's approval. If you have questions or concerns about this, please discuss these with your oncologist. So, what are your options for scalp cooling at UCSF? Well, you actually have two different systems to choose from. They differ in how they work, their cost, and their average success rate of maintaining your hair. The first cold caps option is a machine based continuous cooling system. The system that we have in house at UCSF is the DignaCap Delta. The DignaCap machines include a cap that's connected via a hose to a machine which continuously circulates the coolant throughout the cap. The DignaCap Delta is the first FDA approved cold cap done through a clinical trial conducted by Dr. Hope Rugo here at the UCSF Breast Care Center. At the infusion center, the UCSF medical assistant team will be in charge of your DignaCap cold cap, putting it on your head about 30 minutes before your infusion starts while you are receiving your chemotherapy pre-medications. The fit of your DignaCap is important, and a trained UCSF medical assistant will ensure that your cap fits properly. The DignaCap cools your scalp to around 37 degrees Fahrenheit, which is just above freezing. The cap will remain on during your infusion and for 2 to 3 hours thereafter. This specific post infusion cooling time is based on which chemotherapy treatment you are receiving. You can find exact times on our UCSF Cold Caps webpage. So, if you choose to use DignaCap, you will be at the infusion center for a longer period of time than if you choose to not use DignaCap. In the FDA approval study of DignaCap, on average, 66% of patients retained more than half of the hair on their head. However, this trial did not include patients on an adriamycin chemotherapy regimen. Scalp cooling is usually less effective for patients on an adriamycin regimen. The DignaCap system involves a one-time payment of $250 for the DignaCap kit and an additional $325 per infusion session for the first 8 infusions. All infusions after this will only include a $50 facility fee to UCSF upon checking in at the infusion center. We will discuss payment options, insurance, and patient subsidy programs in more detail later in this video. At the top of this slide, you can see a visual representation of the cooling time for using the DignaCap Delta system. Again, each chemotherapy regimen will have a different post infusion cooling time. Below this graphic, you can see the DignaCap Delta machine in action. The patient's cap is connected to the machine via the black hose. For the DignaCap Delta system, you will also receive a kit, shown here in the photo on the right. The kit will need to come to every chemotherapy infusion with you. And with that, this covers the DignaCap Delta cold caps option. Your second option for scalp cooling at UCSF is Penguin cold caps. Rather than a machine, this manual system involves a set of cold caps that you freeze, either in a freezer that is available at the infusion center or in a portable cooler with dry ice that you must purchase yourself. You put one cap on about an hour before your treatment begins, and once it starts to thaw, you switch it out for another frozen cap. This process requires a second person to help you rotate through the series of frozen caps every 25 to 30 minutes throughout the treatment and for 3 to 5 hours after the infusion, depending on your chemotherapy treatment regimen. Penguin caps cool the scalp to negative 28 degrees Fahrenheit, which is well below freezing. Because this system is manual and requires constant attendance, the UCSF medical assistant team is not able to perform the capping process for you. So, you will need a caregiver to remain with you throughout your infusion and during the post infusion cooling time to perform the cap switching process. Penguin Caps also offers a white glove service for an additional cost. With this option, a company employee performs the capping process for you. While this system is more labor intensive, if you select the portable cooler storage option with dry ice, you will be able to leave the infusion center at the end of your treatment and finish your post infusion cooling on your way home and once you are at home. The cost structure for the Penguin caps is also a little different. The cost to rent the caps is a monthly payment of $449 and an initial $200 security deposit. Again, we will discuss payment options, insurance, and patient subsidy programs in more detail later in this video. Here, you can see the difference in the cap structure between the Penguin and DignaCap cold caps. Again, the Penguin caps are not connected via a hose to a machine, but they will need to be rotated throughout the entire cooling time. That covers your two cold caps options here at UCSF. We will now discuss logistics of hair care, payment, and insurance. Both caps recommend that you take special care of your hair during your entire chemotherapy treatment in order to optimize preservation of your hair. This includes washing your hair no more than once a week and washing your hair the night before your chemotherapy infusion, using only sulfate, silicone, and paraben free shampoos, avoiding hairstyling products, gels, creams, and all hair dye, avoiding heat styling and blow drying, avoiding tight ponytails or buns, and reducing combing to once a day. And lastly, avoiding jostling the hair roots by touching the hair or snagging it on rough clothing or pillowcases. Please consult DignaCap or Penguin websites for additional recommendations. Dignitana does have further specific recommendations for patients using DignaCap. Standard protocol for using the DignaCap cold caps is to spray the scalp down with water to help with the cooling process. Please keep this in mind as your hair will get wet in the process. Some questions to consider might include, when you wet your hair, does it lay flat? If so, then wetting the scalp before placing the cap is recommended. When you wet your hair, does it get fluffier, and or expand to where it could prevent the cap from having direct contact with your scalp? If so, wetting the hair and scalp may not be the best option. Communicate this to the medical assistant who will help you in the infusion center. Next, hair should not have any type of extensions, including sew ins, weaves, lace front wigs, braids, and crochet. It is recommended to not keep your hair in styles with extensions, wigs, or crochets due to the increased shedding of hair during treatment. These styles can cause stress on the hair and follicles that could cause further shedding or damage to the hair during treatment. Hairstyles with too much hair under the cap can hinder the contact of the cold cap to the scalp. The following guidelines are what is best recommended for those with textured hair while using DignaCap cold caps. We understand each person has different hair types and needs, so the guidelines below are standard suggestions. Considerations for patients with natural hair with no chemical straightener or relaxer. Thermally straighten hair before treatment and apply hair grease only to the ends before lightly wetting the scalp. Small twists or braids without extensions are permissible. Considerations for patients with chemically straightened hair. Proceed as normal with wetting the scalp. Again, small twists or braids without extensions are permissible. Keep your hair in a protective style when using cold caps. Small twists or plaits are acceptable to keep hair flat under the caps. Braids, cornrows, plaits, and twists should be done loosely with thin sections to avoid pulling on the hair and causing more shedding. And lastly, hair should be clean and washed the day before treatment. Any oils or serums can be applied to the ends of the hair, but should avoid the scalp and hair follicles. Using a cold cap can be expensive, and there may be some financial and logistical barriers to consider when making your decision about whether to move forward. In the past, cold caps were generally not covered by insurance, and most patients paid for cold caps out of pocket. However, more insurance companies are starting to cover cold caps treatment. As of January 2022, Medicare will provide reimbursements for cold caps use. For DignaCap patients, you will be connected with a reimbursement specialist through DignaCap's patient portal. This individual will assist with pre authorizations, insurance claims, and other insurance related questions. For Penguin patients or for general insurance questions from DignaCap patients, please contact the UCSF Cold Caps coordinator using this email address or by giving the coordinator a call. It is up to the individual to contact their insurance company to determine eligibility for reimbursement. It is best to consult with a representative from your insurance company early in the process to understand what will be needed from you. Lastly, if you have a health savings account or a flexible spending account, these plans can also be used to cover the cost of cold caps. Hair to Stay is a national nonprofit organization that provides subsidies to cover up to $1,500 in treatment costs for patients using cold caps. To determine if you are eligible to apply for a subsidy from Hair to Stay, you can review the eligibility criteria for UCSF patients on our website under How Much Do Cold Caps Cost? Eligibility for Hair to Stay is dependent on income. If you qualify for Hair to Stay subsidy, you can apply on the Hair to Stay website. There are many factors to consider in your decision whether to use cold caps or not, and if yes, which cold cap option is right for you. Each patient has a unique situation, but here are some general guiding questions that may help with your decision. Is keeping my hair a priority during my chemotherapy treatment? Is one of the cold cap systems more affordable for me? Do I have personal restrictions on the post cooling time for cold caps? What is the impact of a longer day at the infusion center for me? Do I want to be able to continue my post cooling time on my way home and at home? Or is it easier to complete the post cooling in the infusion center? Do I have a caregiver who can come with me to perform the capping process if I choose penguin caps? If not, can I afford to pay for white glove service? And lastly, am I comfortable with following the hair care recommendations for patients using cold caps? If you've decided that you want to use a cold cap, what are your next steps? You are responsible for ordering your own cold caps. If you decide to proceed with DignaCap, visit the DignaCap website to place an order and pay for your caps. Follow the step by step instructions for how to order your caps on the UCSF Cold Caps webpage. For all following infusion and treatments, you will need to pay for your cold caps for your infusion at least 1 week before your upcoming treatment. If you choose penguin caps, please contact our Northern California representative, Teresa Daniels. She will help you order your caps and coordinate your storage options. In terms of scheduling cold caps for your chemotherapy infusions, there will be a different process for the different cold cap systems. If you would like to use DignaCap cold caps, please send your oncologist a MyChart message to let them know. If you do not have MyChart set up, please call your oncologist scheduler and let them know you would like to use DignaCap. Your oncologist scheduler will schedule you accordingly from there. After this, the UCSF Cold Caps coordinator will reach out to you to confirm your treatment. If you would like to use penguin cold caps, our representative Teresa Daniels will handle most of the logistics with scheduling for you and help you decide on a storage option. If you choose to store your caps on site at UCSF, you will work with Teresa and the UCSF Cold Caps coordinator to schedule your infusion appointment. If you choose the infusion center freezer option, you will need to drop off your caps on site at least 48 hours before your infusion appointment so that the caps can fully freeze. The dry ice storage option does not require special coordination for scheduling your UCSF infusion appointment. There are some important expectations to set before using cold caps. While cold caps protect some or most of the hair on your scalp, you may still experience hair loss elsewhere on your body, such as your eyelashes, eyebrows, or other body hair. Your infusion day will be longer. Regardless of which cold cap system you select, your infusion day will be longer with the addition of pre infusion cooling and post infusion cooling time. Be prepared for this. You may experience some pain or discomfort in the form of a headache from the coldness. You can ask your oncologist if it is okay for you to take pain medication, such as Advil, Tylenol, or a prescription pain medication, in advance of your infusion. You will get cold. Dress in layers, bring warm beverages. The infusion center will also have warm blankets for you to use. For DignaCap users, if you want to listen to music or watch a video, bring over the ear headphones, not earbuds. Your ears are covered by the cold cap. However, for Penguin users, earbuds can be used. Lastly, please visit the UCSF Cold Caps webpage for an infusion day checklist. If you have any lingering questions, please feel free to reach out to the UCSF Cold Caps coordinator for more information, either by email or by phone. Thank you for taking the time to learn about cold caps and scalp cooling today. We wish you all the best in your treatment, and please do not hesitate to reach out if you have any questions or concerns remaining. Please be sure to also visit the UCSF Cold Caps webpage for more information.